So I'm here with Jen Bruce today, and she is an incredible body mind integrative medicine facilitator and so much more. And so I would just like to take a moment to please introduce yourself and a little bit of your background and who we're speaking to today.
Thanks for having me. Yeah, my name's Jen, and in the simplest form, I would say I just am a practitioner of holistic mental health and addiction recovery. I draw from a large toolbox, so my approach is multidisciplinary. It's trauma informed, but I'm not just limited to trauma. So I'm not a trauma therapist, but that is something that's informed in my practice. And I work with people body, mind, and spirit. So everything from nutrition to when it's appropriate. I'm a licensed psilocybin facilitator in Oregon. I've had over a decade experience in integration work in the psychedelic space, and I came to this work through my own healing journey. I was in addiction for 17 years with alcohol being my primary substance of choice. I now know I come from a long lineage of alcohol use disorder and generational trauma. And then I've been in recovery for almost 15 years, and I got into recovery through the traditional 12-step model, which saved my life. I still am a huge advocate for that process. But for many of us, like myself, it wasn't enough. And the depression and the anxiety and the chronic illness, and now what I understand to be trauma and chronic stress related illnesses just plagued me. So, I went around the world looking for answers. At 3 years sober, I came to ibogaine, which is another, it's a medicine derived from iboga, which is another psychoactive plant medicine from Africa that's really effective for addiction and trauma. And it changed my life so much that I'm now sitting here talking to you today. And the birth of my daughter was another big motivating factor because when I was in the recovery rooms, most of my friends, when I was, young, relatively young for that program in my early 30s, they'd all grown up in sober homes. And so I realized that we were missing something. And I was really inspired to try to take greater lengths to prevent this passing along of the addictive tendencies in my family to my daughter. So that's why I'm here speaking with you today. I've worked in the field for 12 years now, and it's just always so interesting and it keeps getting better. Yeah.
That's amazing. I mean, I can't imagine what it was like to to break the cycle, to actually, you know, I mean, having the motivation of your daughter, but even before that, what did it take you to actually say yes to moving in the direction of integrative medicine and seeking answers?
Mm. Well, for me or for anybody that's experienced addiction, the prerequisite for all of this is sobriety, right? And so for most of us, the motivation was unspeakable amounts of pain and suffering, which is really at the root of it all is a spiritual disconnection from your own soul. And then choosing to turn that pain into a path, right? And then like most of us on a healing journey, we never know what the whole thing is going to be, just the next thing, right? So just what is the next thing I need to do? What is the next thing coming up that I need to work on? So my education and my modality now and the work that I do is really born out of my own journey and the need for finding solutions for myself. And that's where the study began.
And I know from knowing you personally for a little bit now that you have like in a huge arsenal of different integrative medicine solutions and support that goes far beyond psilocybin or ibogaine. That includes nutrition, that includes lifestyle, and like I mean, from what I can tell, protocols, studies, research, like you are just this hub of knowledge on all things holistic and integrative to, and you've like put it together to make it useful to people, because a lot of people are looking for quick solutions, or to like the answer that it's going to be just one thing or it's going to be this and that. Can you speak a little bit more to like the holistic approach that you would take and how you help people like from every angle of the journey?
Yeah. So, yeah, holistic. means that we're looking at the whole person, right? Which is the antithesis of the Western medical model. We're learning more and more that a lot of the things in the Western model don't work. So the Western medical model is really good for saving people's lives, for acute infections, broken bones, physical trauma, these kinds of things. But it's proven beyond a shadow of a doubt that for most people, when it comes to mental health, uh, addiction, these kinds of things, that it really doesn't work, right? And it's because these illnesses, or for lack of a better term, these afflictions are holistic in nature. They affect our mind, our body, our spirit, our emotions. And so in order to get to the other side of these things, you really have to like address all of it, right? And not all at the same time. That's why those of us that have been at this for a while call this a journey. And then we realize that there's no destination. It's the journey that is the medicine. It's the journey that's the joy. It's life is the journey. So a big thing about going onto the holistic side too, and this is where a lot of my work is with a lot of people coming out of the Western model. We can jump into the holistic side. We can come to psychedelics, we can come to nutrition, but everybody's still looking for the 130-day cleanse or the one supplement I need to take, or I'm going to go to this ayahuasca retreat and I'm hoping everything gets resolved in 7 days. And then there can be this real sense of failure because it never works that way until you become more seasoned, and then you realize that it doesn't work that way. And it's this really like when we're dealing with any chronic condition, physically or mentally, we really need to fit out of the stress-inducing culture and societal norms that are causing these things to begin with. So when I say nutrition, it's not going on a 30-day crash cleanse or some hardcore thing. It's about I need to change the way I'm feeding my cells because my body's been sick the way I have been feeding it. So I need to find a sustainable way moving forward that addresses my unique needs. There's not going to be one diet that's good for everybody. There's not going to be one good diet for me the rest of my life or even all seasons of one particular year, right? Holistically, in my area of work means like understanding the relation between the body and the mind and reconnecting that. And it goes, it's good with the trauma field, like that's getting more conversation around body awareness and, nervous system regulation, but it goes so much further beyond just regulating our nervous system and having like physical awareness of the sensations in my body. And this is a good starting point. But there's a body of work that there's a book called How Emotions Are Made, and this woman has done like decades of research, but it really is reflective of the work that I do. Is that in order for us to be regulated and balanced, our body needs the raw building materials of the nutrients to form the neurochemicals that keep the brain chemistry balanced. In order to have a regulated nervous system, I need enough oxygen in my system. I need to be free of heavy metals and mold and chronic infections. My gut microbiome, which for instance is like destroyed with alcohol use, produces 95% of my serotonin, 80% of my dopamine, 60% of my GABA, which is my natural Xanax. So these things are really important, not only it's a body budget, right? So it's how much is my physical body resourced. My brain is essentially monitoring this at all times. And based on my perception of memories in the past, like, and my body budget, this is how I create emotions. And so when we look at even trauma and like PTS, CPTS, it's not a disorder, it's a natural response to things that we've been through in our life in relationship to the capacity that we have in our nervous system. But it's like it's not just regulation that's going to get me out of trauma. I need to, it's being stuck in like a trauma, unhealed trauma, like post-traumatic stress is more of an energy problem on the physical level because as a result of what I've been through in my life, I now don't have the physical capacity energy-wise to have good emotional regulation. And this is where people can miss it when they're like coming to psychedelics, for instance. If I'm severely depleted physically, if I don't have any ability to read the cues of my body and rather than trying to get rid of my symptoms, like I might be coming to psilocybin to get rid of my anxiety, the better way to come is like, what is my anxiety trying to tell me? because it's a signal. And if I come to, say, psilocybin sessions for my anxiety, but my body's not resourced, or if my thyroid is underactive or something like this, like the psilocybin's not automatically going to take care of it. So when we come in from like my holistic approach, we are making sure the body's resourced. We are making sure that we've screened for underlying health conditions, you
Right.
know, and then we're understanding how the medicine works mentally because that's the software, but the body is the hardware, and they both have to be working properly in order for these miracle cures, like in psychedelics that you hear about, to happen. And when you get to understand all of this better, there is no miracle cures or outcomes, and psychedelics are very predictable when approached in this way, right? So it's like considering everything and
So
then
let me
understanding
ask.
it's a journey.
Yeah, that brings up a lot of questions for me. But the first one that's coming to mind is if somebody's considering psilocybin or one of these psychedelics, realistically, if somebody is dealing with toxins or with addiction that's related to a dysregulated microbiome and, not or exposure to mold or these other things, or, I would say on the energetic level is just as important as far as like trauma from either this life or generational trauma that they're carrying and how that interplays as well. How realistically, before even considering one of these psychedelics, what does it take, or is it really variable depending on the person as far as going through a like a gentle or holistic detox protocol to allow the body to start regulating itself enough to even being able to consider one of these other options to deal with things like depression and anxiety that, play hand in hand with PTSD and trauma and addiction.
Yeah, that's a really good question. So in the psychedelic field, we talk a lot about preparation and integration. And so what you're speaking to there would be a really important part of preparation that most integration therapists, psychedelic integration coaches, and providers are really missing still. Because we're still, even in the psychedelic field, we're really looking at this through the lens of psychology and psychiatry and pathology rather than like holistically.
Mm-hmm.
But at the root of it, these medicines are very functional in nature, meaning that like in functional medicine, it's still science backed, but we're looking at the systems of the body, and we learn to interpret the symptoms as messengers and the possible root causes, and we follow those down to the root. And so part of a good preparation for going in for psilocybin or other psychedelic therapies would be to clean up your diet. I don't, some people might not be able to go on a cleanse. Maybe if I'm going in for an eating disorder, see, this is again, there's no cookie cutter. Like if I'm coming in for anorexia or bulimia, the last thing I want to do is put somebody on a cleanse and a restrictive diet. They may not even be able to eat very much. So then I might be like, let's go get some IV nutrients to bring up your nutrient status because we know that you're low. I do see like because these nutrients are needed to build the neurotransmitters that help balance the brain chemistry. So we're kind of like rising up to like meet the medicine and say, here, I'm here to work with you rather than to have you do it for me. And the medicine really likes that. It's very intelligent. They're sentient beings and there's a spirit to these medicines. And if that sounds weird, trust me, if you
No,
try
it
them, you'll
doesn't at all.
understand.
Absolutely not. You're
Um,
in the right place.
yeah, and so that would, but then somebody else like that's in a position to do a nice cleanse and stuff, then yes, it depends on who's coming in. If it's an opiate person for withdrawal, we know that the opiates slow down the digestion and cause like constipation, and the bacterial overgrowth can really affect the mental health. So if they're in a position and feel comfortable, might be a good idea to go get some colonics and move some of that out of the way so the medicine doesn't have to work so hard, right? So there is the physical preparation is very important, and it's going to vary from person to person on their unique constellation of limitations and abilities before they go in. Yeah.
Right.
And then also it's another on a deeper level because this body literacy is really what we're missing in recovering from mental health, from trauma, from addiction. It's misunderstanding the cues. And so, what we're doing before we go into the medicine is we're starting to connect the mind body a little bit so that when we get in there with the medicine, it makes more sense.
Mm-hmm.
And we're preparing ourselves after the medicine to start these practices afterwards because we're more clear and that density that can block us sometimes is not there. And this is an ideal time to start working on that, like after we come out too. So that would be a piece of what preparation for psychedelic work would look like and working with me at least.
Right. And I mean, it makes me curious too. I mean, I don't know, I'm not literate in all the different psychedelics and differentiating them and how they work on a physiological level. And I'm curious about just knowing that certain psychedelics are purgative, or they may actually induce, the body's microbiome to reset itself and then have a natural detox, maybe some more for some than others. Can you speak to that a little bit about how you've seen that happen for people? Because I've heard cases too where somebody's microbiome will reset or they'll have a purgative response and their mental illness will get better. But then, once life happens again, or maybe their diet goes out of whack again, then basically things come back.
Yeah. Yeah, so that's a really good point. So just like there's no one solution, like one cure, one retreat, one whatever, there's also never just like one root cause, right? They come in constellations is what I call them. And so the three roots of the stress-related illness is in my practice, I've defined it as epigenetics. We know genetics are not set in stone now, very rarely are they. Lifestyle and trauma or toxic stress, whichever term you feel more comfortable with, but those combine to come up and create a tree of all of these symptoms. And so, what's beautiful when you come into the psychedelic space and why I prefer plant medicines always over any lab made molecules is that they have this supreme intelligence of the human body. They know how to go in there and scan, see where things need to be healed, and they understand human physiology and what we need to heal better than anybody on the planet. They just know. And they've been with us since the beginning of time, arguably. So they know that not only is the gut and the brain connected, but it's the same system. So you can't have good mental health without good gut health. It's not possible. There's also a microbiome in our brain. And for those of you that don't know, the microbiome is the 5 to 7 pounds, so the size of a small newborn baby, like that same weight of if when healthy and in balance, beneficial bacteria that's largely responsible for our genetic expression. It's largely responsible for the quality of our immune system. 80% of our immune system's in our gut, and it's largely responsible for the manufacturing and the utilization of the most famous neurotransmitters responsible supposedly for our mental health, right? And so a lot of people in the holistic field are like, we don't believe in the serotonin theory at all. And it was manufactured in a lot of ways to validate the products that Big Pharma is selling us, but they also do matter, but it's not just a brain chemical imbalance. So if we want to look at brain chemistry, we're going to be looking at the gut first. And so the medicines will get in there and they will be there may be a purge. I've been present with iboga, especially like a lot of people with coming for treatment resistant, quote unquote, depression, and they get rid of a bunch of parasites. Like I've seen huge parasites come out of people. That was something after all of their years of therapy, psychiatry, even visiting the Western doctor that was never screened for.
Mm-hmm.
Even if we do a lab test, a lot of the parasites may not come up.
Right.
That's one reason that you would purge. Also, it's scanning the body to get toxins out. It is emotional. So one thing that we direct people in the space when working with these medicines is to pay attention in the mind, what's coming to the mind while the purge is coming up because there's a connection there, you know. And then also that's where a lot of our neurotransmitter activity takes place. So if you look at the side of the bottle for antidepressant, always, if it's a serotonin associated like antidepressant, there's going to be like one of the number one side effects is gastrointestinal upset
Right.
because that's where all the activity is. Yeah. So
Right.
those are some reasons that you would experience that.
I'm curious too, are people ever given anti-parasitic medications like ivermectin in preparation, in addition to, dietary content?
Not not to my understanding as part of a preparation, but a lot of people that are coming to medicine work have tried a lot of those things. I hear, so it wouldn't be unusual that somebody has taken ivermectin, but it wouldn't be like part of the preparation necessarily. Hmm.
I've been curious about this for a while. So having, worked in acupuncture and Chinese herbalism, now for in some form, way, shape, or form for the last 14 years, um, I've seen an incredible number of people who are on antidepressants, anxiolytics, antipsychotic drugs, and so many of them are incredibly addictive just in and of themselves. If there's not even a history otherwise of like, you know, drug and alcohol abuse or addiction, but just simply going through the natural response of anxiety or depression from stress and then being put on some of these medications that cause addiction. Have you seen success in people being able to gradually or in some form eliminate the need for some of these pretty hardcore pharmaceutical drugs in the process of working with the plant medicines and nutrition?
Yeah, that's actually something I specialize in is helping people get off medication, especially who are in recovery from addiction because they're so overly diagnosed and overly medicated.
Mhm.
Yeah, it's a really big problem, and they don't warn people of any of this. They say it's totally safe. So it's actually they're breaking the law. Every doctor takes an oath of do no harm, and that there's a term called informed consent where the patient has a right to know everything about something before they take it. And rarely is anybody ever told that these are some of the hardest drugs to get off of in the world. And the studies are now coming forward that they actually often cause the symptoms that they claim to treat, and they cause brain damage over time,
Right.
even leading to things like dementia later in life. So they come at a great risk,
And the
and they are
gut
hard to get off
issues
of.
and GERD and things like that.
Yeah, and they do say now because the diagnostic criteria that they use to diagnose psychiatric disorders is called the DSM-5 now, the Diagnostic and Statistic Manual.
Mm.
And they do say that if they were to trauma inform that manual, that 80% of the diagnosis would become obsolete. And the problem with that is none of these medications treat trauma or heal the nervous system. It's through lifestyle, it's through nutrition, it's through creating neuroplasticity, whether you use plant medicines or not. There's other ways to create neuroplasticity, but we know the brain can heal now. They're doing research with the veterans at Stanford recently with ibogaine, and they did brain scans where the brain's actually regrown. This is unheard of, it's unprecedented. And so the problem is with the FDA, we not only don't have one prescription medication that's approved for the treatment of PTSD, but there's nothing that shows any hope. But yet, the majority of people that are being diagnosed with, anxiety and depression and these kinds of things being put on medication, most of them are dealing with a dysregulated nervous system, not a genetic, chemical, incurable brain disease. And so then people don't get better because they're not treating the underlying cause. And then the narrative from the prescriber is that, see, you're getting worse, you need more medication. And then you try to come off of it, and they don't tell you that it's withdrawal. They say that you're sick and you see this is your illness, but it's withdrawal. It's withdrawal. So there, yeah, you can get off. I got myself off of them. That happened to me in early recovery.
And how long is withdrawal typically, or is there a typical
It
withdrawal
just
period?
depends. It depends on how long you've been on the meds, how many. How motivated are you? Are you willing to make dietary and lifestyle changes? Are you going to step into the space with entheogenic medicines or not? Um, mm, you know, it really starts with also you have to believe that you're not broken and sick. And that's the hardest part for people to get over because when you first get off of them, don't feel, there can be moments where you don't feel very good. And we become very attached to this fake sense of security that we've been given. And so letting go of that and trusting that your body can heal is probably harder for people than it is the actual withdrawals. But if you do it slow and steady over time, and most people are just trying to get off, but if you bring in the nutrition, especially if you learn how to regulate your nervous system and map your nervous system state, if you learn how to start reading your symptoms rather than being afraid of them, if you heal your circadian rhythm and get good quality sleep, you live in, adopt a low anti-inflammatory lifestyle, lower your stress, all the things that are actually causing this while you're coming down, then you actually start to feel better because you're nourishing yourself. And so you can actually start to feel better as you come off of them rather than worse if you do what you need to do
Right,
to
right.
make that happen.
And I
Mm.
kind of, I'm going to shift gears a little bit into the relationship with the plant medicine, into a little bit more of the energetic side of things and what happens even on a spiritual level when people are going through this process. Because I think that, trauma and addiction for many, who choose that experience here can be a catalyst, can be an impetus to grow and learn and evolve in a tremendous way and in an expedited way for a lot of people, in a way that can create a new sense of purpose or service in the world, especially for many healers, right? So I want to talk a little bit about, what's coming to mind is that transition into coming more into a holistic space and building a new relationship with food, building a relationship with the actual earth and the not just the plant medicine, but food itself, the consciousness of the plants in all different forms that they have. Because from my perspective, like when I talk to the plant kingdom, I see them as actual beings. They're actual, like they're personified in my mind when they come in, and they speak and they hold wisdom, and every single one of them, from like the broccoli to the mint leaf to like anyone coming in, and they offer us so much information, and the ability to speak to our bodies and communicate. And so I kind of want to speak to when, someone's in that process. I imagine that there's not like a flip of a switch when someone is like, I'm no longer addicted, or I'm no longer, suffering from these things. I mean, maybe some people have these aha moments of like, yes, I'm free, and then life moves on. But I don't think it doesn't really work that way typically, that there's a steady growth process. And I just want to ask you a little bit more about building a relationship with the plants and in systems of like microdosing, what that looks like, or as a practice, or as I mean, I don't know much about it at all. I've only heard of people like kind of recreationally self-dosing with microdosing, but is there actually a systemic or a practitioner guided system that you can see people learning how to regulate their systems and build new relationships with themselves and the plants themselves?
Yeah, yeah, yeah. I agree. All the plants have the wisdom. Nature is so highly sophisticated, and we've been brainwashed to think that it's not.
Yeah.
I mean, it's perfect. So with microdosing, yeah, like there is a way to go about it, uh, medicinally or therapeutically, and it does vary from a larger dose, but in a lot of ways, I think there's more benefit. But this again, we have to be committed to the process, and it's a skill, whether we're doing microdosing or macrodosing or anything in between. It's a skill that we learn, and it's important. Like a lot of my work is education. Like we need to know how these work because we're so misinformed in the West here. Oh, I just take something and it makes me feel different, I'll just take care of it. But this commands that we show up and work with it. It's neutral. It's very powerful, but it's neutral, just like money is. It's like I have money. What is my relationship to the money? How am I working with my money? Is either supporting me or not. It's either harming me or others or not. And so, in the same way, this is just kind of this neutral but very strong energy that it's kind of up to us to open up to working with it. And so, this is a big thing about like finding our agency and also radical self-responsibility. So, with microdosing, there's downsides to it maybe, but then there's also upsides. We know like for instance, with psilocybin, that after or any psychedelic, that after a larger dose, there's this period called the critical window. And what that means is that there's a period of time where we have a heightened amount of neuroplasticity, which makes it easier for us to form new habits, let go of things that are no longer serving us. It's kind of like they equate it to like, I've been up on this mountain and a sled going down the same slope all of these years, and the ruts are super deep, and I want to be over going down that one. And I know I do, but I cannot like get out of these deep ruts to get over there to go to the new slope. And so this is like it snows and there's a fresh layer of snow after the journey. And then I can much more easily, like, I still have to make the choice in my own free will, and there is some effort involved, but now I can redirect my sled over to this new slope. So if I go in for a big journey, it's going to be more neuroplasticity. I'm going to get more insights. It's really like a peak experience. And I come here, and then I come up here and then I'm here. So in Oregon, we've only been in practice for about a year, a little over a year and a half now. But what we're already seeing is that you would think if somebody took a 4 or 5 gram dose, they'd have more, like a greater chance of long-term outcomes being beneficial. But what we're seeing is they might a few days afterwards be above their outcomes, however they are ranking them, than somebody who took 1 to 2 grams, which is like a lower dose, but not a microdose. But then when they're checking in like 6 months and a year later, the person that took the lower dose is actually doing better than the person that took the bigger dose.
Huh.
Why is that? They had less shown to them. It was a smaller experience. So you're more likely to be able to integrate
Right.
what you were given, meaning that integration is interchangeable with education and application. The journey itself will do absolutely nothing. That just gives you perspective,
Mhm.
and it's like shows you where your work is, and then afterwards you listen, you share that with somebody, and you're like, good, okay, it sounds like it's time for you to get to work. So if I get shown in a larger journey like the meaning of life and this and that, and I get brought to my past life or whatever, that's really wonderful. But then, like, how do I bring that into my life so much? So with microdosing, it's incremental in small doses over a period of time, like say we take 30 days. And so at the beginning, it's going to be more challenging because just like at the beginning of any bigger journey, at the first part, it's this emotional and physical purge. It's getting the stress out. There might be shaking or crying or physical purging or something, but it knows that we have to get the stress response out, the toxins out. Yoga knows this, right? Like the physical practice of yoga is simply to prepare the body to be open for meditation. So if I'm microdosing, that I'm going to be learning in real time how to sit with negative. I might be taking microdosing because I want to get over anxiety, but at the beginning, I might amplify my anxiety because it's wanting me to look at it.
Mhm.
Or maybe it's clearing out some of this excess energy. So I need to develop a skill and come, find a way to be okay with being uncomfortable at the beginning sometimes. And then we work through things, but it's extended. So I'm getting a little bit, I have a little bit of neuroplasticity. I make that little change. I see a little result. I do the same thing over and over again because if I just make a little tiny change here over time, it's huge.
Right.
And I'm noticing that my cravings for sugar are diminishing. Okay, I'm gonna jump on that. That's telling me sugar's been bad for me. It's telling me not to do that, so I'm gonna not do that. And so it's a practice. It's like you're going to find a lot of effect with yoga, but you have to go regularly for a period of time to really get the benefits. And so that's a very similar way to look at microdosing.
Right. And I think
Mhm.
another way I look at it too is any practice that's purifying the system from an energetic standpoint, whether it's breath work, yoga, meditation, acupuncture, body work, it's all giving the body a chance to make those new choices because it's like once you have that kind of greater capacity to hold light and to nourish yourself and resource yourself, like why would you want to put something toxic in your body? Kind of feeling. Like last fall, I experienced a really intense experience of shock, and it opened up my whole Kundalini from top to bottom. And I immediately stopped drinking coffee. And this is somebody, I've been drinking coffee since I was in seventh grade, and I'm 34. So it was so stark to have this energy opening up in my body. And I've had other experiences like this too, where it's like my instinct already, because there's already so much energy flooded through, is like, how could I put something that's going to create inflammation or a stress response that's more than the intensity that I'm already experiencing because it was such a big shift. But I love the explanation of doing it in small doses and integrating over time and how that's more beneficial than taking a larger dose. I think that's a huge light bulb for
I
probably
mean,
for
it
a lot
can
of
be.
people too.
It can be, but then if I'm in acute post-traumatic stress, I might need to go in for a big dose because I can't handle it depends on it again, it depends on the individual, right?
Right. So how
Yeah.
do you discern if somebody is has the capacity for a larger dose if they're in a heightened state of stress like that? Because
I
I
mean,
mean, even opening up at a larger dose, they might see something really scary or deal with something really intense, you know?
yeah, and sometimes that can be a contraindication. So, I mean, I have my own process of interviewing people, assessing, starting out where they need to go. A lot of people come to me, they've already made a decision because my work has mostly been integration. So I might have somebody that's already decided to go to ibogaine or already decided, they want to do this or that. But if they're coming to my practice for psilocybin facilitation, there's quite a bit of a screening process. And then even if you're going to go in for a larger journey can be 1 to 5 grams, or more. And so there's a big variance in that space too. How much experience with altered states do you have? You know, is this a life and death situation with somebody who's about ready to die of addiction or suicide? Because this is also like a high risk, high reward space, and just like treating cancer, not every cancer patient's going to survive. They're just not, and you don't really, sometimes you don't know what the outcome's going to be until you go through it. But there's definitely, we're standardizing like safety protocols and screening in the field now more and more that now that we're becoming legal and making sure that it's safe for the person to go through. And if somebody comes to me and I'm not qualified or I don't have the credentials to hold the space for their particular situation, I will quickly refer out to somebody that does. um, and then some people aren't a good candidate at all, but it's rare. It's rare, and microdosing is a good thing to know whether you do larger doses or not, because the truth is you don't always have to go back for these big, huge peak experiences to get the benefit that you're looking for.
Right. Can you speak a little bit to the differences between using some of these different substances? Like, why would somebody seek ibogaine versus psilocybin versus something else?
Yeah, so I mean, ibogaine has been proven through the studies at Stanford and otherwise that it's probably the most effective medicine on the planet for addiction and for trauma. So for veterans, for those that have really been in the throes of addiction, iboga and ibogaine tend to be the most helpful. That being said, it's also the one that's like potentially fatal. It's the only psychedelic that's potentially fatal. Um, so there are contraindications. So not everybody's a good candidate for that. Also, ibogaine is expensive and you have to leave the country. I would not ever recommend going for an underground treatment in the United States. There are a lot of really underqualified people providing ibogaine that should not be. Never go to receive ibogaine without medical oversight in a medical setting. There needs to be a doctor, an ER nurse on site. They need to have medical equipment. So I can't unrecommend underground treatments in the United States or elsewhere more. Um, there's a lot of problems in ibogaine space, iboga as well. So the expense can get in the way. Um, Ibogaine's a big medicine. It's not for everybody, right? And then so if I'm going in for, looking for a safer route, more affordable, like psilocybin's really accessible right now. It's the safest psychedelic. It's a lot more gentle. There's different energies, and then we know that psilocybin can also be really helpful for addiction. John Hopkins has extensive research on its efficacy for alcohol use disorder, right? A lot of veterans even are claiming that psilocybin has been extremely helpful. Ayahuasca, so it's good to just study up on the what the different medicines are known for and what they're not. They can all work. I've seen all of them work for all different things for different people. A lot of it's which one do you feel called to?
Mhm.
Which one do you feel called to? And I don't recommend if you're novice and you're coming in for like treatment resistant depression to go down to the jungle in Peru and do ayahuasca on your first trip unless you are going with somebody who is extremely experienced because there's not Not all providers are good. There's abuse that goes on in the space. There's poor handling of the medicine, a lot of underqualified people. And so if you are going outside of like clinical setting, you really want to do your research or anywhere that you go and make sure that you're going to a good provider. And if you're not, don't go at all. So that's another way we decide like what medicine's coming into my field. Have I found this really amazing provider? What are my resources? Where can I go? And which one's calling me, right?
Right. What is
Um,
your opinion of all of these ayahuasca churches popping up in the United States, and the regular? I'm seeing a lot of groups that meet almost monthly or sometimes even more frequently.
I'm not really familiar with the that tradition, but I do know that certain traditions, it is a church and they do meet regularly and it's their sacrament. I know some people that have drank hundreds of times and it's great and it's just the path, it's a spiritual path that you're following.
Mhm.
Have a, and beautiful, have a good teacher, be following the path. A lot of Americans and Westerners get stuck and keep going back because I need that high. I need to feel better. And, these medicines will temporarily help you feel better afterwards. But again, it's the neuroplasticity space and the regulations so that we can apply what the medicine has shown me. And so many people misunderstand that. And then after the window closes from anywhere from 2 to 4 weeks with ayahuasca, psilocybin, and up to 6 months with iboga or ibogaine, that they're like, oh, I need to go back. It's like, well, did you integrate everything? Because you're not supposed to always feel like that all the time, right? So we can get stuck in these traps of going back, and that can be really dangerous.
Mhm.
Um, I don't know how I feel about all the churches opening up. I know that there's a lot of really bad providers and a lot of really bad things going on in the space. So I just say be careful, and then also the medicine must want to come through or this wouldn't all be happening. But it's a wild west right now, and you have to be really discerning of who you sit with, where you go, energetically, spiritually, physically, financially, all of the above.
Right,
And it's your job to educate yourself on what these do and don't do so that you don't fall into the traps.
right. And I think one of the biggest traps that I've seen in this country, and I've only, I've seen it through clients of mine and friends who've gone to Central and South America seeking all sorts of different, psychedelic experiences or answers to questions, or some of them depression, anxiety type stuff. But really coming back and having no ability to actually, or no resources to integrate when they come back to the United States, because, if you're taking a plant medicine that's part of that indigenous culture and it's part of the land and it's part of the tradition to be able to, sit in an extended medicine space with an elder who can help you along the way, and people are going down and just doing it for a weekend or for a week long trip. What would you say to those people who come back to the United States and don't know where to turn or what resources to look for in order to be able to start integrating that experience in a healthy way?
Yeah. So I would say best to find an integration coach or therapist of some kind before you go to properly prepare because you need to prepare for when you come back before you leave.
That makes sense.
If you've already gone and you haven't done that, then find some support. I will say that you have to know how to find a good integration coach or therapist too. The space is flooded. Excuse me. And I used to teach at one of the top coaching programs I used to teach, and I will tell you that there's a lot of coaches floating around that should not be coaching. So do your due diligence, find somebody who's qualified that understands your unique situation because integration therapy isn't going to be across the board. Every coach is good for everybody. But like, the reason we're needing to leave this place to go get help is because it's our society that's making us sick. And it's physiological, it's emotional, it's spiritual, it's mental. Like if I'm in a toxic relationship and I go to South America for a ayahuasca retreat and I go home and I stay in a toxic relationship, I'm going to be depressed again or anxious really soon. I don't have a disorder. My body's trying to tell me I need to get out of this relationship. So we also have to come into this work in a kind of a warriorship type of a way. Not, I hope this fixes me. I only ask medicine, show me what I need to see, give me the strength to get through the journey, and give me the grit to do what I need to do afterwards to make the changes that I need to make. And sometimes that means I need to exercise more. Sometimes that means I need to get a divorce, even though we've got 4 kids. Um, Maybe I need to quit this corporate job because it's sucking my soul. Okay, what's my relationship to money? So I need to be prepared for this and knowing that when I come home, I can't go back into societal norms that were making me sick to begin with because nothing's going to override that. The medicine will show us what we need, and then we need to do something about it. So when we go through journey work, all I can ever say is that it really just gives us breadcrumbs. Like it might show me something, like say I don't know what it would show me, but maybe it shows me my grandmother was really sad and I never met her and she was crying a lot and she was young, and that tells me that my grandmother went through something. Okay, well, what does that mean? Okay, generational trauma, that I need to start researching what that means. And from there, like a whole world can open up. Like I renegotiate my relationship with the family or whatever it might be, but it's just going to show us some things, and then it's our job to research that afterwards, and that's going to lead me to the kind of support that I need coming home, right? But then also, it's really important post ceremony, integrating back into our society, that we only share our experiences with people who understand. Because if we share them with people that don't, they're not going to believe us and it's going to question our own experience. And then the validity and the potency and the medicine that comes from these journeys we give it away because we have to believe it to be true. And this comes back to the work of Dr. Bruce Lipton, who discovered epigenetics, and his book is The Biology of Belief. What we believe actually influences our genetic expression. So we have to keep this like really close to the heart and only share it with people that are understanding of what we've gone through, especially at the beginning. Also, when we get home, no new decisions, no major decisions or major changes right away. The integration process is first making sense of what we were shown, and that can take some time. Also, not everything we were shown or visions or downloads of what we're supposed to do. Some of this is like trauma pattern getting released. Sometimes it's trying to release some of our egotism. Like, maybe I'm not supposed to go home and start a reality TV show about, my life or something. That was my ego. Like, it was showing me like my ego. So it's also the discernment around what was an actual vision, a download, what is, trauma loop thinking, like getting released, what was my ego getting released. And so we want to give it space for a while before we even decide what we're supposed to act on or what we're not.
Right.
Yeah.
Beautiful. I mean, yeah, I'm really thinking about all these different beautiful medicines. And I personally, full disclosure, I have no experience with ayahuasca, ingesting it. But I have taken psilocybin once, not in a clinical setting, but I was out in Sedona and I was with a dear friend and kind of, in a safe space. And we were out in nature. And it was the first time in my life that I felt good in my body. And I actually said it out loud that I love being in a body. And I was so surprised to hear myself say that. And it was a very different experience from, say, Bufo, which I have experienced once in sacred space. And I was definitely the person who did not prepare in the way that I should have. And I didn't know how to integrate my experience. So um, that experience is part of what's leading me to ask you a lot of these questions as well, because I really, in the interest of the safety and sanity of people who are going into these psychedelic experiences without having a background in that, I think due diligence and safety and every kind of precaution is so critical, and having a community of support, including, the therapists and the licensed practitioners, and including dear friends who can understand the validity of what you're experiencing on a psychedelic level, and those symbols and meanings sometimes that come through. and how it changes you fundamentally. I mean, with that neuroplasticity, like for me, the veil became very, very thin. And it's honestly still really thin, but it's different. Things have just changed quite a bit. But what I didn't expect or know after experiencing bufo, which is the toad, which is also a form of 5-MeO DMT, I didn't realize that it would take me at least 6 months to integrate. And that the first 2 months, at least, the veil was so thin that I was seeing the non physical even more clairvoyantly than I already see. And I was working at a hotel, a very, very haunted hotel, like a resort in Asheville, North Carolina. And I just remember working at a desk and seeing everyone walking around and coming up to me and seeing their loved ones around them who had passed and the ghosts who were walking around the hotel and all of the different beings who were there. Like it was just like the wildest experience, to have the veil be that thin and to just stand there and smile and just think, pretend to be human, pretend to be human. And I mean, being in the position where I knew I had to work and I didn't have the kind of support I needed to be able to just be out in nature like I would have otherwise, or like really focus on, I mean, I was really focusing on a clean diet, and that was a huge piece. And obviously, not ingesting any kind of alcohol or things like that. I think I was still drinking coffee at that point. Probably less so though, because my system had, I mean, I didn't have a purgative response, but definitely, um, spiritually and emotionally, yes, that part was very purgative. So definitely not a medicine I would recommend to like 99% of people, with that experience. But it was just one experience. So, I also can imagine that everyone's experience is extremely different going into it and with their intention and with their preparation as well. So, yeah,
Yeah, there's a lot to it. And it's just a skill that you learn over time.
yeah,
Or you can go one time and not have to go back again.
yeah.
Um,
I
it's
mean,
different.
I'm very interested for myself in microdosing. And
Yeah.
I mean, not for the more for the like the neuroplasticity side of things and like the self-regulating my nervous system side of things. Um, and really honestly building even a deeper communication with nature and with the plants themselves. Um, I also kind of recognize that you can call in these frequencies, you can call in the medicines without ingesting them. You can start meditating and building a relationship with the plants without, having to ingest them, and creating your own sacred space to do that.
Hmm.
Or, creating a space in your garden or in a park, and just dropping in. So,
Yeah. And you can get through the same thinning of the veil through regular yoga practice.
right,
It's just like,
right,
can I commit to that? But then I know people that have been in yoga and it wasn't enough to get down to the trauma. So that was my story. So it's everybody's different. And yeah, you can just connect with the spirit. I mean, it's like flower essences are so powerful, right? That's such powerful medicine.
right,
Hmm.
right.
Yeah.
Well, this is a really cool conversation. I could probably keep going on and on. I think maybe just to kind of close the space, if you could share a little bit about what you're up to right now, if you have any resources for people to share, or if there's any way that they can get connected with you, that would be lovely.
Yeah. They can find me at humanscanheal.com. And I have a free Three Roots ebook download available for people there, and it basically explains my ecosystem's approach to healing from stress-related illness. And then I have a blog there. I offer a lot of like free or low-cost workshops, and I do obviously work with clients as well. So you can just find me over there or on Instagram. It's humans.can.heal, and I'm around, so that's the best place.
Awesome. Well, thank you so much for taking the time and for answering all of these like really poignant questions that I think a lot of people are interested in and that you really just don't learn about otherwise, you know? But just the, it's so key to have that holistic perspective and to really have a realistic approach to, you know, what does it actually take? The resilience, the grit, the commitment, and the self-love that it takes to move through, you know, moving out of addiction and trauma and getting your life back.
Yeah,
It's huge.
that's right. Yeah, thank you so much for having me.